This section covers a lot of information regarding disabilities with dementia clients. So I'm going to go ahead and jump right into it. So caring for elderly with disabilities. This session is, we're going to talk again about the skills involved when caring for elderly with certain disabilities in conjunction with dementia. So let's start off with the basics. What is a disability? The definition is a physical or mental condition that limits a person's movements, senses, or activities. In this specific training session, we're going to be focusing on physical disabilities, cognitive disabilities, behavioral disabilities, and slightly on social disabilities. So let's just go ahead and jump into physical disabilities. A physical disability is a limitation on a person's obviously physical functioning, their mobility, their dexterity, so holding on to things, or their stamina. Some people are born with physical disabilities, while others acquire them in life due to accidents, injuries, or illnesses. Some are side effects of medical conditions, and here's a list of a few. So you can take a peek, cerebral palsy, MS, epilepsy, carpal tunnel, amputations, spinal cord injuries, arthritis, we see a lot, especially with our clients, and vision or hearing impairments, okay? Now, for most of us, the discussion about dementia centers around memory loss. And though that's understandable, given the devastating impact memory loss and confusion has, what's often overlooked is the physical manifestation of the disease in the mid to later stages. So these types of things we see happening as they progress in dementia, like the loss of mobility, incontinence, loss of pre-programmed tasks, and dementia with pre-existing conditions. So we're going to go ahead and discuss each one of these a little bit in detail. So for example, mobility. As dementia begins to attach the brain cells associated with muscle awareness and movement, your client will certainly notice some major changes, specifically loss of balance and loss of strength. We see this time and time again. We know it. It's not just with dementia. It's also coupled with old age, but the dementia process really attacks this and makes it a lot more of a detriment. So along with the physical decline, we know that they will experience a lack of cognitive awareness as well, which means they're not going to be as capable of recognizing that they can't do things physically, right? This would lead to larger issues with their mobility. Like attempting things beyond their abilities. Climbing into a bathtub, for example, might be difficult. Or forgetting or refusing to use equipment like their walker or a cane. They think that they can get up by themselves, but they need a little assistance, but they can't remember. So if your client isn't carefully watched over, these issues could result in a fall or cause a serious injury. Right? Knowing their abilities, like we have been talking about in all of these sessions, and what equipment they need to use will help to avoid some of these accidents. Let's move on to incontinence. All parts of the brain can and will likely be affected by dementia. So this includes the nerves that relay bathroom urges and the muscles that can control the bladder function and can become impaired. Right? We see this also pretty regularly. Dementia clients may not be able to locate their bathrooms in their house, especially if they moved into a new place or a facility. They might not remember where things are. Closed doors are really dangerous. They don't know what's behind them. You might remember this from the safe environments sections that we talked about last year in our basic dementia training. They may not be able to communicate their needs. We've talked about this many times too, that it takes time for them to verbalize what they're saying, or if they are unable to speak, they can't communicate their desires and needs or urges to go to the bathroom. So physical disabilities also include pre-programmed tasks. And what do we mean by that? We mean that your client may experience an inability with simple tasks that they have been able to complete their entire lives. Like holding the remote, brushing their teeth, combing their hair, dressing themselves. These things that they've been doing since they were children, that's why they're pre-programmed. It's just like second nature stuff that they might start losing, right? This ability could worsen over time, causing them to even get down to like chewing and swallowing issues, right? This is part of the degenerative idea of dementia. We know that they're going to lose their abilities, so we have to make sure that we are keeping up with their abilities to help them stay safe but also still promote them individually. I want to touch base just briefly on the pre-existing conditions and physical disabilities with this. So many of your dementia clients may have other conditions underlying their dementia. Like it could be as simple as poor eyesight or hard of hearing to larger diseases like Lewy bodies, which is notorious for having a dementia that goes with it. Understanding these conditions will help you provide a better care for your client, of course. And what we can do is provide an environment that they can feel safe in. If they need glasses or hearing aids, make sure they're nearby. Make sure that they're clean and accessible. You want to make sure that there's walkers and wheelchairs around as well. Think about their risk factors. Are they a fall risk? Do they have high blood pressure issues? If they stand up too fast, will they fall? All these types of things we need to keep in mind because they, again, might not remember as they start progressing in their dementia. All right? So let's go ahead and move on here to cognitive disabilities, right? This is the bread and butter, basically, of what we think of when we think of dementia. Dementia is usually diagnosed when a cognitive impairment has become severe enough to compromise a person's social or occupational functioning, right? So what we're saying is cognitive impairment can only consider dementia when it has affected two parts of their brain function, right? So that means two of the following: memory, thinking, language, judgment, or behavior, right? We know that dementia has huge impacts on memory. We've talked about how it impacts their judgments and their thinking, their communication levels, their language, and how they behave. We'll talk about that in a little bit. We always think about this. It's almost always a given when you're dealing with dementia clients. This is part of what happens. So we're going to actually just go ahead and jump into the behavioral disabilities now. So studies have shown that approximately 30 to 90% of people diagnosed with dementia suffer from some type of behavioral disorder. So these can include depression, anxiety, agitation, aggression, right? Typical things we see in dementia clients. Understanding the signs of certain behaviors can provide you evidence as to what may be causing them. Again, we know this. Lots of times it's just unmet needs. Let's take a look a little deeper in these, okay? Let's talk about depression for a minute. Depression is a highly common mood disorder. It affects people of all ages. However, between 9% and 68% of all dementia cases have reported depression as well, right? So that includes apathy, loss of interest, isolation, social withdrawal. Now, a lot of this can be depression, and a lot of these things are just how they're feeling or what's happening because of their dementia. And that's kind of why there's such a big discrepancy between the 9% and 68%. It's hard to do. It's hard to get a perfect image of who has been diagnosed with it. In addition to these symptoms, your client's cognitive impairment makes it difficult for them to articulate they're sad, if they're feeling hopeless, if they are feeling guilty, or their other feelings. So sometimes the symptoms of depression are mirrored just because they have a hard time communicating their actual feelings. The most common treatment for depression and dementia involves a combination of medicine, counseling, and gradual reconnection to activities. Now, obviously, we're not going to do any diagnosing, so we're not going to be providing any medication or counseling. So what we can try and do is some simple ideas that definitely can help, like creating and sticking to a daily routine. We talked about this in another session, how important those routines are and how that can give people so much comfort knowing what's coming next. We can make activities lists based on your client's preferences, right? Making sure that they are doing things that they enjoy, that sparks them joy, that gives them purpose, gives them, positive feedback. We want to exercise regularly. Again, the positives for physical and cognitive abilities there is huge. We want to acknowledge, and here it is, validate their feelings, right? Always, 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 because that gives them some sense of reassurance that they're not wrong, they're not crazy, and their world is their world, right? We want to celebrate their small successes. Everybody likes getting a pat on the back. Everybody likes being told that they did a good job. They're no different. Your clients are no different, right? And we want to find ways that they can contribute. That inclusion is so important to give them a sense of purpose. Again, just what they can do. Focus on their abilities, right? Most dementia clients who are depressed may not have as long-lasting symptoms. They may, however, come and go. And so you'll see waves of depressive moods followed by maybe some euphorias and maybe some more happy times. It just kind of goes back and forth. The next behavioral disability we're going to touch on is anxiety and agitation. This, again, hands down, very common stuff, right? We always see these anxieties. We always see these agitations. They're very common behaviors exhibited by dementia clients. This can be seen as restlessness. It could be outbursts when in certain places or when focusing on something specific. Anxiety and agitation can be caused by a number of medical conditions, not just dementia, medication side effects, but many times with dementia clients, it's just biological. If something is going on in their brain, it's no longer to negotiate new information or stimulus, and so things can get really confusing, and they can get really anxious or agitated because something's causing them to feel away, and they can't remember what it was. We talked about this in communication with the bookshelves. They can't remember everything that's happened, but they remember how they feel, right? And so that can be really frustrating, building anxieties and agitations. Some situations or triggers for anxiety and agitations could possibly be moving to a new home or residence. Those big changes are hard. Changing the environments, traveling, hospitalizations, having house guests, things that are out of the norm can really be difficult for your client with dementia. Caregiver changes, when people change, when people go on vacation, we have to bring somebody else in. Disrupts their routine. It's a new person that they're unfamiliar with. It can really be a tough time for your client there as well. Misperceived threats, misunderstanding. Oh, they think I'm threatening. You're coming to the door. You're going to hurt me, but you're just there to take over for the day. These things are difficult. We know that. And fear, along with any other unmet basic need, all these things can put your client into an anxious feeling with agitations as well. Now, there's a bunch of ways that we can actually help prevent or reduce your client's anxieties and agitations, right? First and foremost, we want to create a calm environment. Maintaining noise volumes is so important. Use things that can keep them calm, turn the TV off, put some soft, quiet music on. That can help too. You want to avoid the triggers though, like background noise that's too loud, television that's too loud, radio that's too loud, too many things going on at once. An interesting one is glares on the windows or off of a television screen. Or mirrors, things like that can be really difficult if they may not recognize themselves. You want to monitor their personal comfort. Check for pain. Check if they're thirsty, if they have constipation, if they have to use the restroom, if they're tired, if they got some skin irritation, if there's a button or their belt is, or whatever the case may be. If it's digging into them, we got to make sure that they're comfortable. And the room temperature, they're really sensitive to temperatures, much more than we are. So further, we want to make sure we simplify tasks and routine. We want to give them the basics, the very simple ideas, give them directions step by step. And to exercise. Exercising is such a great way to help reduce anxiety and agitation. All right, next on our hit list here is aggression. Aggression is tough because your client's mood can change rapidly and often, and many times for no apparent reason, right? Dealing with aggression is always difficult, but reminding yourself that it's not the person's fault, but it's the dementia can help us cope with it, okay? Some things that can trigger aggression is physical discomfort. Again, the environmental factors and poor communication. Sometimes the anxieties and agitation turn right into aggression. So trying to stop it before it gets here is really, really important. Frustrations like this are obviously enough to make anyone mad or upset, not just your clients with dementia. But those who do suffer from dementia often can't remember why they feel the ways, or I have a much more difficult time trying to cope with the changes and things like that. Now, so similar to the anxiety and agitation, the aggressive behaviors are caused by an unmet need most of the time. Not always, but it's a great place to start. So some physical needs that could be causing aggression are the inability to communicate pain. Maybe they have a UTI or other infections. Obviously, we cannot and we will not be diagnosing any of these things, but we can be observers. We can look for differences. You can notify us at the office. We could talk to the family. They can get it checked out. And then we can find out maybe that's what's going on. Maybe they're just tired. Maybe they've been sundowning, or maybe they haven't been sleeping well, or they're getting up in the middle of the night. These types of things. I mean, people get cranky when they don't sleep enough, right? Same thing with if they're hungry or thirsty. Sometimes just providing a snack could curb that aggression. Just leave it out. Just a small little thing. Doesn't have to be a lot. Hopefully that'll help. Maybe they just need something to put in their belly. Now, the environment can easily cause your client to become aggressive as well, right? We talked about this before. Loud noises, overstimulation, cluttered rooms, too much stuff. It can feel like they're getting trapped. Large crowds or unfamiliar people, and maybe even the people that they do know but they can't recognize anymore. That can be a really frustrating, building anxiety, boiling over into aggression. Feeling lost. They could feel lost with a million people. They could feel lost at home. They could be outside and feel lost. And depending on what time of the day it is, many people are best in the morning. The elderly you get up in the morning and that's the best time of the day for them. Scheduling activities at those times that's best for your client will also help reduce aggression later. Trying to have them start a task, later in the afternoon when they aren't feeling so great, it could easily push them into an aggressive state. I mean, we know how frustrating it can be when we don't get understanding to people, right? And when people can't understand us. Our clients with dementia are physically unable at times to communicate with us, right? That would put me over the edge. So what we can do is to simplify instructions and tasks. We can limit our questions just one at a time, wait for them to answer you, and don't offer so many words, and what's also really important to remember is they might be picking up your stress or your irritability as well. Yeah, dementia is tough and it tries our patience, especially with repetitive actions and questions and things like that. And we can become stressed and we can become irritable, which they might just mirror back to us. It's really important to try and make sure that we stay in control of our feelings and our emotions while we're dealing with these people. So how can we handle aggressive outbursts from our clients? All right, here's just a couple quick ideas. We can identify the immediate cause as best we possibly can. It's not always easy, but sometimes we can. Like ruling out pain. Focus on their feelings. Don't focus on the facts. Again, that's validating. Validate their feelings. Just because it's not true in reality doesn't mean it's not true in their reality. Okay? Don't get upset. It's going to be tough sometimes, especially when they might be yelling at you. They might be swearing. They might be spitting. They might be throwing things. Don't get upset. All right? Make sure they're safe. Walk away if you can. Limit the distractions. Turn off the TV while the radio's on. Turn off the radio while the TV's on. Give them a magazine to look at while nothing's playing. Try a relaxing activity. There's a million things, and Joyce can go over all sorts of great activity ideas with you. Shift their focus. Try and change gears. Get out of the activity you're doing or away from the thing that they're fixating on. Something like that. Take a break. You can ensure their safety. If they can be safe without you for a little bit, you can step in the other room, take a break. Have them take a break. Sit down, watch TV for a little bit. Anything just to kind of calm them down. So behaviors will change and their intensities as well as your clients progress through the stages of dementia. We know that. Some clients may, again, have underlying conditions that could impact these behaviors. Things like anxiety disorders, bipolar disorder. Maybe they have an eating disorder or excessive compulsive disorders. Right now, understanding your client's history will allow you to prepare yourself to provide that optimal care. And we will give you all the information we possibly get and can give you off the bat, so you're well informed. And so going through this, though, you might have to talk to the family. You might have to do some little investigative work yourself and try and find clues and things and how to help them out. So we're going to go ahead and start talking about the social disabilities, though, at this point, okay? Now, social disabilities are recognized as deficiencies in areas such as self-control, self-monitoring, and empathy. These are patterns that we easily recognize in our dementia clients, right? As the brain is damaged by dementia, it eventually loses the ability to control urges and results in sometimes pretty inappropriate behavior, right? And a lot of it has to do with the lack of self-control. All right, so our fully functioning brains, you and I, we can then take this information and translate our natural desires into a proactive and appropriate reaction. So a good example is this. You might be hungry when you see a kid holding an ice cream cone, right? You want it. But we don't want it. We're not going to go and just take the cone from the child, right? Instead, our brains, because they are functioning and working properly, can direct that desire. We can walk over to the ice cream stand and purchase an ice cream cone for ourselves, right? Similarly, we might feel an urge to go to the bathroom halfway through a movie, right? Our natural desire is just to go right there. However, we are, again, with a working brain, are able to translate that desire and can decide how long we can actually wait and then wait or make the choice to have to go. We can also find a bathroom at that point. Now, some of these urges can be a bit more inappropriate than trying to grab a kid's ice cream cone. And some clients may display inappropriate touching or sexual behavior, right? And yes, we still understand that this is not the person, but the disease. However, it's very inappropriate behavior and it has to be addressed. So if you have a client that is displaying this sexually inappropriate behavior, here's some tips for you. First of all, stay calm, stay patient, okay? Gently but firmly tell them that this is inappropriate and it must stop. You want to match your body language to your words. Want to make sure that you're being firm but still gentle enough. And you want to react consistently because this will probably happen time and time again. Now tell them you got to tell them that you don't like that every single time it happens, right? We need to make sure that you don't mix signals. We want to make sure we're consistent with this. Try and redirect them. Give them something else to do. We know the more you know about them, the easier it is to redirect, right? We keep on telling you, got to know the person. You got to know their likes, their dislikes, their histories. Once we figure that stuff out, we can redirect them away from this and focus on something more, beneficial. And if you can, try to identify the triggers so we can prevent it from happening. The sooner you know what's causing it, we can try and make those changes so they don't do it again. Now, self-monitoring is a little different than self-control, right? We understand that our clients with dementia are unable to perform self-monitoring, which is the process in which a person monitors their self-presentations, expressive behavior, and nonverbal affective displays. So simply put, it helps to define certain personality traits and a person's ability to accommodate social situations, which we recognize is really difficult for dementia clients. Right? As their dementia progresses, your client's going to lose more and more of their ability to do this, and that's why it's so important that we're there to maintain their safety, their comfort, and give them an opportunity to be themselves in social situations that is safe and acceptable. All right? I want to touch just briefly on this empathy because some dementia clients have this, but this is not a very common issue, but it's worth folks just paying attention to for a minute in case it does happen, because you never know, right? So clients that suffer from dementia go through many changes and their ability continually change or decrease. Now, some studies have shown that people with dementia, specifically this frontal temporal dementia, undergo a really startling change in personality marked by the lack of empathy and dulled emotions, meaning they can't empathize with you or they don't have any emotions towards you. And it can be really, really hard to deal with, especially for families and loved ones, okay? And meeting these attempts of affection, they're usually dealt with confusion. Now, this lack of empathy and misunderstanding of affection is primarily attributed to the fading area that's responsible for social functioning. So the idea that empathy in and of itself is abstract, right? And so therefore it's much more difficult for a client suffering from dementia to be able to comprehend it. It doesn't make it any easier to deal with in what seems like a departure from their own personality, okay? So if your dementia client has a lack of empathy, here's what you need to do. you need to remember that knowledge is key. All right, remembering that the disease is causing this, it's not their personality that's changing.